I'm Dr. Mendoza, and I'd like to talk to you a little bit about those unpleasant sulfur burps that people experience while taking GLP-1 therapy, which includes medications like semaglutide and tirzepatide. It happens because the GLP-1 therapy slows your digestion down to help keep your appetite under control, but this can cause food, especially foods that are very high protein, high sulfur content like red meat, eggs, and certain protein powders to ferment longer in your gut, releasing a rotten egg smell. How you can reduce this: choose lighter proteins like chicken and fish and other plant-based protein options like tofu. Eating smaller meals to aid in this digestive process. Staying hydrated is key to help your gut move that food along, and avoidance of carbonated beverages, which can also release gas and cause stomach upset. Some natural remedies that I recommend are marshmallow root, which coats the lining of the stomach and esophagus, a good probiotic to provide that healthy gut bacteria while on GLP-1 therapy. And finally, ginger is good for mild nausea and indigestion, which are both common symptoms of taking tirzepatide and semaglutide. Remember, if sulfur burps are persistent, please talk to your healthcare provider and see if any other adjustments need to be done or possibly a lowering in the dose of medication. I'm Dr. Michelle Mendoza. I'm happy to be here to help you with your wellness and weight loss needs. Thank you.